season, and we're going to talk to an infectious disease expert about it in just a moment. But first, for more background on just how bad it might be, let's take a look at this package from NBC's Dr. John Torres.
At New York's Maimonides Medical Center, Dr. Eitan Dickman is on the front line of the flu season.
Nationwide, the flu is starting to kick in right now. It's early January. Is that the same thing you're seeing here?
We have definitely seen an uptick in the number of cases related to the flu over the past few weeks.
According to the CDC, this year the H1N1 strain, also known as swine flu, is responsible for the majority of cases, particularly in those under 40. Just last month, 26-year-old conservative journalist Bree Payton died from it.
We've already seen thousands of hospitalizations this year, and we will expect a whole lot more because that's what influenza does.
With last year's flu season one of the deadliest, the CDC recommends everyone 6 months and older get the flu vaccine.
If someone out there still hasn't gotten the flu shot, we are still strongly recommending that they go and get the flu vaccine.
If you do get sick, there's a new drug called Xofluza. Unlike Tamiflu, it only takes one dose. It's not even peak flu season yet. That's usually late January or February. So the worst possibly still ahead. If you haven't gotten your flu vaccine, it's definitely not too late.
And joining us to talk more about this is Dr. Amish Adija. He is an infectious disease expert. He also is a senior scholar at the Johns Hopkins Center for Health Security. Welcome back, sir. How are you?
Good. Thanks for having me back.
All right. We say we're not in full swing of flu season yet, but is it going to be any worse than any past flu seasons?
The early indications are that this flu season is going to be less severe than last season. We had kind of the perfect storm last season with a poorly matched vaccine, a very strong strain, and a huge dip in vaccination rates, all which led to kind of a record-breaking flu season. This year is going to be kind of a general flu season. We're going to see people die. We're going to see some crowding in hospitals, but it won't be as bad as last year.
The vaccine has been matched fairly well this year with the disease?
It looks like it, that the dominant strain that's causing flu in the communities is matched well to the vaccine, so we don't expect to have that problem like we did last year. So the flu vaccine is very effective. It appears to be this season, and I encourage people to still get it if they haven't.
It's not too late to get that vaccine?
No, we're just starting to see really widespread flu activity around the state and around the country. The traditional peak of flu season is in February, so we do have some months before, a month or so before we really get hit hard with flu. So I do think that if people haven't gotten the flu vaccine, there's still time to get it, and it should be helpful.
I know you may be weary of disabusing people of this notion, but there are all sorts of people out there in our audience, and it needs to be said again and again, who are afraid of vaccines for all sorts of reasons, whether they claim it's going to stimulate autism in their children or the mercury in it is going to poison them. What can you say as an expert about these vaccines, about those fears?
Most of those fears are completely and totally misplaced and have also been disproved and debunked. Vaccines do not cause autism. The mercury that's in certain vaccines isn't the kind that causes damage. And vaccines have really added decades to the lifespan of every individual. The reason why children are not dying in childhood anymore is because we've got vaccines. It's probably one of the most greatest technological marvels that the human race has ever invented. And probably more important than the iPhone in your hand is a vaccine.
You know, you talk about all the things that are out there and whether or not we are prepared for these kinds of flu epidemics. What do researchers do to prepare the vaccine, and how far in advance do they have to work and guess to get it right, or is it more science than guessing?
It's more science than guessing, but in some ways it still resembles guessing. We have a very large lead time to develop a flu vaccine, so the strains are selected months before the actual season, sort of based on what's happening in the southern hemisphere, which is opposite to the northern hemisphere. But they
because that's where it comes from?
Well, because of the winter.
Southern to northern?
Well, we know that flu has this seasonality, and in temperate climates likes to spread during winter season. So you can kind of look at each other's season. The northern looks at the south looks at the north, to try and figure out what's circulating around the globe. And you make the best estimate that you can. But the lead time, because we make most of our flu vaccines in chicken eggs, and it takes a long time to do that, causes things to happen late in the season, for example, late in the southern hemisphere season, and you can't change the northern formulation by then. So sometimes we know we're going to have a mismatch, like the prior flu season. We're getting better at doing it, and we have newer vaccines that can be made more rapidly, but still the bulk of our flu vaccines are still made the same way that they were in the 1940s, and that's why we get mismatches. That's why we have to get a flu shot every year. That's why we have to update it, and that's why it's only, in the best cases, only about 60% protective against getting the flu.
Yet you say this is one of the greatest technological advancements that has increased lifespan. Yet I see lifespan for Americans is starting to decrease. It's not because we're not getting our flu shots. There are other reasons?
Right. So, when I say that about vaccines, I'm talking about vaccines in general. Smallpox, measles, mumps, rubella, all of the pneumonia vaccines, all of those together have really impacted lifespan in such a way that we've kind of had tremendous strides, and childhood isn't a time when people were sick and dying. We have seen lifespans drop in the United States, but I think it's interesting if you look at that data and you remove opioid overdoses and homicide and motor vehicle accidents. And
suicides, perhaps, too?
Yeah, it goes up to one of the highest in the world. So I think that the data is a little bit more misleading, but it's unequivocal that vaccines have really impacted the lifespan of the world in terms of childhood mortality.
I understand we're talking about America right now, but you mentioned the world, and I just wonder how vaccines have helped other people in other countries, and what's the problem with getting them the vaccines? Are there cultural and religious fears overseas?
There's a lot of factors that play into how well vaccine uptake is in other countries outside the United States. Some countries are very pro-vaccine, and we've seen tremendous strides. So parts of Africa, for example, childhood mortality has been impacted significantly. We're trying to roll out measles vaccines there, rotavirus vaccines. All those childhood immunizations that are routine have really made huge impacts there. But there are countries, for example, where there are problems. So right now, polio only circulates in 2 countries, Pakistan and Afghanistan. And vaccinators there are being killed by the Taliban because they do not want vaccinators in those areas that they control. We've seen parts of northern Nigeria where there have been rumors spread by Islamist preachers that they're getting sterilized with the polio vaccine there, so that there's been uprisings against polio vaccinators in northern Nigeria. Europe has had a huge...
Some of them have been killed.
Yes, definitely. And in Europe, for example, in Italy, there is a very, very strong anti-vaccine movement. We've had major measles outbreaks going on in parts of Europe. So the world for vaccines isn't the most rosy outlook. We've got a lot of forces against them, despite all the evidence of how great they are.
You know, when I was a kid, measles were very common, and almost everybody went through that. Have we eliminated those through vaccines here in America?
In the United States, all of our measles cases are imported, meaning someone goes to Europe, brings them back. We have a big outbreak in Rockland County, New York, related to travel to Israel. But not for the whole area. We used to be completely eliminated, North and South America, but right now we've had measles ongoing in Venezuela for over a year, so that elimination status is gone. So we've done pretty well with measles in the United States, although we're still at risk for importations, and we have a record measles year going on as well. But Venezuela has really set back the entire continent of the 2 Americas right now because of the ongoing transmission.
What about Ebola? We hear about continuing outbreaks in African countries about Ebola. Is there a vaccine for that?
There is a vaccine. It's experimental. It's made by Merck, and it's been very impactful in the current outbreak that's going on in the DRC, the Democratic Republic of the Congo, which is a very scary outbreak, which is plagued by violence in these no-go zones where people can't do any kind of public health work. We had a very tumultuous election there where people who were in the Ebola regions were not allowed to vote, which caused more problems. We've seen people destroy hospitals and attack UN peacekeepers there. So this Ebola outbreak in the Democratic Republic of the Congo is probably the most challenging Ebola outbreak that we've ever seen, even though it's only the 2nd largest in terms of numbers.
You wrote a column recently that was titled, "The Flu is Far Greater a Threat Than Anything Carried by People Crossing the Southern Border." That headline might be a little bit misleading. It almost sounds like you're agreeing with President Trump that the people coming across the southern border are bringing disease to our country.
No, it actually means the other, and I actually didn't title it that.
Yeah, I know you don't write the headlines, right?
No, what the point of that article was is that I do not agree with demonization of migrants coming across the border. What I'm drawing attention to is the fact that we're in the midst of flu season right now, and we've had a death from a child in a migrant detention center from flu, whose diagnosis was likely mishandled. So I do think that there is a risk of influenza anytime you house people together, whether it's in a school, whether it's in a camp, or whether it's in one of these migrant centers along the border. And I think people need to be vigilant and think about that and not be panicked. The United States is already experiencing widespread flu activity in about half of the states. These migrants are not going to really add much to that flu burden, but the people taking care of them need to be cognizant of this fact and know that we're in the middle of flu season and you're housing people there, so that you need to think about respiratory virus outbreaks like flu and not allow what happened to that child who died on Christmas Eve to happen to anybody else.
Is the Border Patrol ill-equipped to handle these kinds of outbreaks in these encampments where people are close together and these viruses are likely to spread?
It's hard to say. I know that after this death there has been some movement to try and fortify the medical resources there. So they have the U.S. Public Health Service there, they have the Coast Guard there, all working to try and screen these individuals that are coming in. And now medical examinations of children are mandatory. But it's always going to be a problem when you have people that are maybe malnourished or dehydrated, who we don't know they may not have been vaccinated against flu, who are being housed together. So you have to be really vigilant. So they have to make sure they have hand hygiene stations for those people. Maybe they have flu vaccination clinics there. And they also need to be vigilant when people get fevers and coughs and try and really aggressively take care of those patients so they don't spread it amongst themselves in those groups. But this is flu season, so we're going to see that in multiple different enclosed situations, whether it's there on the border or whether it's in a school right here in Pittsburgh.
But I would imagine the Border Patrol and the Coast Guard are ill-equipped to handle that. That's really not part of their primary mission.
Right, it isn't, and we've seen them make requests for the CDC and the U.S. Public Health Service to fortify that, so they do have some ability to do it. But this hopefully will dissipate as the flu season dissipates and as they get more resources to take care of those people, as more public attention is put on the fact that there are cases after that child died of flu. So I don't think it's going to add to the burden of infectious diseases in the United States, but I do think that people that are there need to be cognizant of the fact that we're in flu season and there are going to be flu cases there.
Do you think that the government shutdown has any impact on this and the resources that they have to deal with people who may not be hydrated or vaccinated who are coming to our country?
From my understanding, the government shutdown doesn't affect essential workers, and most of the public health workers and physicians that are employed by the federal government are still being paid. I'm not sure of all the nuances of that, exactly what's affected and what isn't infected, but I'm sure that the government shutdown does impact the ability to deliver these types of services in many different ways, even if it's not just with the physicians.
Back to America and the flu here, what's the best way that we can control it here? Hand washing, vaccines? How is the epidemic going so far?
The vaccine is the best way to prevent the flu. It is about 60% protective from getting the flu in the best of seasons, but it is very highly protective against getting hospitalized with flu, getting pneumonia with flu, dying from the flu. So that should be the cornerstone of our prevention. Hand washing, good cough etiquette, making sure people cough into their elbow, not into their hands. All of that plays a role in it. Right now, in Pennsylvania, we have widespread flu activity. Almost every county is reporting flu cases. We haven't had any pediatric deaths, but there have been adult deaths from flu. Like I said, this year it's going to be milder than last year, but we are not really at the peak of the season yet, so it's a little bit hard to tell exactly where this is going to go, but I suspect it will be better than last year.
Who's most vulnerable and likely to die? The elderly, the young, anyone?
Usually in flu, it's the very young and the very old that constitute the bulk of the deaths that happen. There are other people that are at high risk. Those pregnant women, for example, are very high risk for flu, so they are one of the highest priority groups to be vaccinated. People who have underlying medical conditions, lung disease, asthma, emphysema, people who have other underlying immune problems, so people with HIV who maybe had an organ transplant or are getting cancer chemotherapy, those are who really constitute the biggest risk groups for flu.
Do you think that any of these drugs that are directly marketed to people right now, because I see in some of the disclaimers that it may lower your ability to fight various diseases, do you think that that has an impact on the flu at all?
Definitely. We have a large population of immunosuppressed people. So that might be people who have cancer, who have HIV, who have an organ transplant, who are on anti-rejection medications, those with rheumatologic conditions like rheumatoid arthritis or or autoimmune disorders like Crohn's disease, they're all taking immunosuppressing medications, which put them at high risk for flu. So they should be among the first people who are vaccinated against flu. And if they do get flu, they should be treated very, very aggressively because they are at higher risk for developing pneumonia, need for hospitalization, and severe disease from the flu.
And your bottom line is get vaccinated.
Correct, yes.
The elderly and the young, if they're otherwise healthy, why should they be more concerned about the flu? You mentioned them first as the ones who should get the vaccine.
So when we look at the epidemiology of flu, who's getting sick, who's dying, who's getting hospitalized, you see this kind of U-shape. So you see this big peak at the very young and a big peak at the very old. And that has to do with immune system differences, how much physiological reserve, how well they can fight these things off. So they are among the highest groups. And if you look at it in total number, there's so much more of the very young and the very old than any of those other risk groups. So they will constitute the bulk of deaths from flu in every season. So they're the ones that we really get the message out to, along with all those other risk groups.
Have you had your flu shot?
Yes, I did.
Okay. All right. We're going to take a break. When we come back, we'll ask Dr. Adagia about neuroviruses and some of these cruise ships that are reporting people getting sick. What's the problem? Should you take that cruise? We'll talk about that later. And also, we invite your questions or comments. 412-333-PCNC is our number. We'll be back in a moment.
You need more light, but installation is expensive and small stick-up lights just don't get it done. Why settle for one light when you can have 60? Introducing the Bell & Howell Light Bar, the incredibly powerful portable light with 60 LED lights. Now you can have light anytime, anywhere you need it. Whether it's around the house where you always wished you had more light, or take it outside and finally illuminate that shed. Brighten up your workshop like the pros, or take it with you to get the wide, bright light you need to see everything. And it's so simple, one charge can give you 12 hours of power with 60 LEDs that are rated for up to 10,000 hours. And that needs no batteries ever, potentially saving you hundreds. The Bell & Howell Light Bar has two powerful modes, bright mode for everyday use or insane mode with 720 lumens of pure power, and is strong enough to be seen from over 2 nautical miles away. So it's perfect for camping, fishing, or hunting. And you can stabilize the light bar anywhere with 2 built-in stands to light up a backyard barbecue or balance right on the engine block under the hood. Then fold in and lay on its back for under the sink. You'll be amazed at all the places you can use it. And when the power goes out, the light bar automatically turns on, keeping you and your family safe. Amazing. And the light bar gives you 60 times the lights of this flashlight. Portable lights are hot, bulky, and can cost hundreds. But the light bar goes anywhere, never gets hot, and weighs in at only 1 pound. When you call or log on now, you'll get the Bell & Howell Light Bar for the low price of only $19.95. But wait, order right now and we'll ship it to you absolutely free. And when you order today, you can double the offer. Just pay a separate fee. Bell & Howell has been a trusted brand for over 100 years, and the Light Bar is only $19.95. But you must order now.
To order, call 1-800-764-4196. That's 1-800-764-4196, or order online at trylightbar.com.
Adagia is our guest. He's an infectious disease expert, and we're talking to him about the flu. We invite your calls at 412-333-PCNC. We're going to turn our attention now to some of these cruise ships and the neuroviruses that cause people who are passengers there to become very ill. Let's take a look at this report from NBC's Kerry Sanders.
Passengers on board Royal Caribbean's Oasis of the Seas say the ship was anything but an oasis. Hundreds of passengers spending much of the cruise sick, with gastrointestinal symptoms, nausea, vomiting, diarrhea, believed to be norovirus.
You don't really want to get out and do anything because everyone else is sick, you're not feeling well, so you're confined to a tiny room on a cruise ship, and it's really just terrible.
Cody Haddad and his girlfriend are still on the ship, disappointed how their dream cruise turned out. We spoke to him by phone.
It just feels like a sick ship. It's just something we don't want to be on anymore. It's really a nightmare.
The first couple of days were great, he says, including this Tuesday visit to a private island in Haiti. But that's when people started getting sick, including Cody and his girlfriend.
Almost everyone I talk to has personally been sick or knows somebody that's ill.
Nearly 8,500 people are on board. Royal Caribbean says only a small percentage are affected. The ship left port on Sunday. The itinerary is supposed to include Haiti, then Jamaica, and Cozumel, but Jamaican government officials wouldn't let them dock. Trapped in their cabins, several passengers took to Twitter. Passengers also posting pictures of the crew, trying to wipe out the fast-spreading virus. Royal Caribbean deciding to cut the cruise short by 1 day, returning to port Saturday, telling NBC News in part, "We think the right thing to do is to get everyone home early, rather than have guests worry about their health."
Dr. Misha Daja is our guest. He's an infectious disease expert. I've heard so many reports of these cruise ships having these kinds of problems. You write about people being in a confined space, and that's like a small city, 8,500 people on that one cruise ship. It must be awfully easy for noroviruses to spread.
Yeah, it's kind of like a tinderbox or a powder keg for any kind of virus, especially something like norovirus, which is highly contagious and very hardy, lives on environmental surfaces, hard to clean. And you've got people that are on vacation who don't want to be sick, so they may kind of try to get through the symptoms, go out and enjoy themselves, and at the same time spread the virus all around. So this is really a perfect storm for a virus like norovirus.
And I can imagine if they did have some stormy seas, everybody's grabbing on to something ahead, really, and the person ahead of you just did that. If they have any of the noroviruses, you'd like to touch it and get it yourself,
yeah,
right?
It's very contagious. People get it very easily, and it comes on very quickly, and it can be pretty explosive, especially the vomiting, and that vomit itself is infectious, and it gets aerosolized all over the place, so that becomes a huge challenge for these cruise companies to clean these boats and scrub them all down. But overall, we're seeing a decrease in the number of these outbreaks, but we still have them from time to time.
So if I were to take a cruise, how should I prepare myself?
You could maybe ask your physician to give you anti-nausea medication ahead of time in case you do get sick. And then I think if you're on that cruise ship and you see people sick or see people vomiting, go the other way and tell someone, because often these things don't get reported, and then these things get bigger and bigger, and people aren't confined to their cabins, and it spreads throughout the population of the ship. So it's really important to tell someone that, hey, I saw some people vomiting there, and kind of stay away from those people and stay downwind. Don't sit downwind of people vomiting, which will make you sick as well.
So if you see something, say something.
Sure. Yeah.
But I wonder if that's enough. Is there any inoculation that you can take before you go on board one of these ships?
No, there is no vaccine against norovirus. There are ones that are in clinical trials. I think it'll be really important to get a norovirus vaccine, because not only does norovirus cause these cruise ship outbreaks, it's the major gastroenteritis virus in the United States, and people get them all the time. We have outbreaks at nursing homes and hospitals. We have outbreaks at restaurants. For example, Chipotle had a norovirus outbreak. So this is something that's very, very common, and a vaccine is desperately needed, because it is a very disruptive illness if you've ever had it.
Well, let me return to the shutdown, the government shutdown, because I understand a lot of employees from the FDA or whatever agency it is that looks after food safety are not on the job anymore. What do you foresee in the future if this shutdown continues and they're not doing the work to keep us safe?
Right now, the FDA's domestic food inspection service is not operating at full capacity. Their international inspections are still going on normally.
So no inspection of romaine lettuce to prevent those kind of outbreaks, or meat or anything else?
It's unclear how much of their operations are disruptive, but we have been getting multiple foodborne outbreaks. This season has seen 2 back-to-back romaine lettuce outbreaks. So it's going to be kind of a tenuous time to see how well they're able to, how well we're to keep ourselves free from outbreaks with the food inspection service kind of disrupted right now. But hopefully we'll get lucky and we won't have any new outbreaks. But I think it's going to be challenging.
Currently, do you think that we're safe as an infectious disease expert?
In general, I think the United States is a very safe country from infectious diseases, but I'm always looking at threats that are occurring all over, from outside this country, inside this country, and I do think that when you have disruption of our public health workforce, it does put everybody at risk.
Are we ever in danger of experiencing a flu epidemic like 1919, 1920, where people went to card games and the next day they were dead?
That's the biggest fear. We're 100 years away from the 1918 outbreak, and that outbreak was probably one of the biggest infectious disease emergencies the whole human race has ever faced. We had probably 100 million people dead, a third of the population
worldwide
infected, yes. This is something that...
That sounds as bad as the bubonic plague.
It was worse than the bubonic plague.
Wow.
So we all prepare for that, think about that, and I think there are some factors that probably make us at higher risk and some that make us at lower risk. We've got big mega cities. Travel times are down very... You can get from one part of the world to the other part of the world very quickly. Before, the virus spread at the speed of a ship. Now it goes at the speed of a jet. So we do have a lot of factors that play into our vulnerability to a flu pandemic, and it is the thing that we all dread.
All right, Dr. Adaji, we always appreciate your visits here and informing our audience about these important matters. Thank you very much, sir.
Thanks.
All right, I'm Chris Moore. We'll continue our program in just a moment. Stay tuned.